Even though this is not my general area of scholarship, I felt a certain kinship, I guess, to this content. I was born into the Air Force. My father was in the military for 27 years. I lived on military bases, and I was a child of military deployments. And I worked in the medical ICU as a VA nurse. And so I understood some of the unique challenges of working with the veteran population. There are 23 million veterans living in the United States, and 16% of them have service-related disabilities. But of that group, only about 38% receive any care from the VA system. When they go to somebody outside the VA system, they might not even ask if they're a veteran, let alone take into consideration environmental exposures that they may have had, as well as psychological exposures. Each graduate nurse needs to be cognizant of the type of issues that are unique to the veteran population. Be able to recognize when those issues are occurring with their patients and understand what sort of interventions are appropriate for those issues or what sort of referrals. As part of the initial project, one of the things we did was develop an elective for undergraduate students called Caring for America's Heroes. And in that particular course, we covered basics related to the VA system, the military, as well as specific issues related to veterans' care, such as how to recognize PTSD, how to recognize when a patient might be suicidal, those sorts of things. We realized through that experience that really all our undergraduate nurses needed to learn something about care of veterans. We developed an initial set of competencies and the knowledge, skills, and attitudes related to those competencies to put them in effect. We ended up with 11 initial competencies, and the knowledge, skills, and attitudes related to those competencies, which we sent out to faculty across the country whose institutions had been funded by VANA in the past. After we compiled all the data, both quantitative and qualitative, from the reviewers, we had a final set of 10 veterans care competencies and associated knowledge, skills, and attitudes. What we hope will happen is that schools of nursing and perhaps even healthcare institutions that are hiring new graduates will take this list of competencies and associated KSAs and see how they might be able to implement them, focusing on exactly what components are the most important for a graduate nurse to understand about care of veterans. The next steps in our work are to develop toolkits for faculty in undergraduate nursing programs to help them implement these competencies into their curriculum. Another goal would be to extend this work to advanced practice nurses.